Right on that. Right on that. Oh, it's USB. It's USB. Forward. Hold on. Yeah, you're gonna you can sit on right side, but come from that side. Come from that side. I sent you something on your phone. One moment, please, doctor.
Whoa, baby, baby. Sit down with us, bend down with us, bend down with us, sit down with us. I've been waiting. Nobody nothing knows that me and you are touch. Nobody nothing knows that you are give it up. Nobody nothing knows that you come over me, baby. You know me love your body. Nobody nothing knows that me and you are touch. Nobody nothing knows that you are give it up. Nobody nothing knows that you come over me, baby. You know me love your body. Every time you come in, I take you on me.
You can hear it. Actually, I really prefer you didn't use the headphone. Clip on this with the microphone. Put this onto your shirt. Yeah, turn it this way. Okay. Can you hear that? Can you hear it? I don't want to use the headphone because I can't. Dr. Parkins, can you hear me?
Yes, I can.
Okay, good. You hear it? You don't need it.
Are you hearing me, Doc?
Yeah, she's hearing me.
No, but want somebody.
Yes, I can.
You can hear me?
Yeah.
Yes, I can.
Okay, good. Okay, we'll come back to you in a second.
You stay there. You
Okie dokie.
remember you jump on that. You can't move.
Oh, my mic is.
First thing I'm going to do is when open
Oh, you do it. Let me see that.
And the eyes. Oh, can I pause this mic? Oh, yeah, I need to stop it when I want to talk. Huh? Yummy. No, me not talk that.
No. Are you in it? Then I'm going to go and get it. I'm going to put you to get it.
Thank you, sir.
So, I mean,
Appreciate it.
you have one more road that I'm just going to talk about there. You have some cheers and you have a wood barrage and stuff. But the record, don't put the record.
No. No. Yeah. But me need to pause this.
All right, listen. I'm going to go live now. It's okay.
Oh, you pause this. Yeah.
See this? I don't want you to mess with this, but you see this right here?
Yeah.
Use this mouse. You see
What's
this?
her face now?
You can.
Yeah.
Right? It's live now. No. Me pull the thing off and you like go backside. Yeah.
You have to go address it. You go address it before we start.
Pata. I don't need to shut it. I don't want to do that because I'm going to do it. All right. I'm going to flip it in the door. That's why we're on.
Pleasant good night, Dr. Root. Welcome to another edition of the Tony Culture Time. Dr. Ruth Parkins, thank you very much for tuning in. Thank you very much for taking time out of your busy schedule to be with us at this time of the night, 10 p.m. Thank you very much. How was your day today?
Awesome. I had an awesome day today, sir.
Awesome day. Now, you're the owner for Ira Dental, which is located in Bloomfield, New Jersey, and also Orange, New Jersey. Talk to me about what makes you decide to open it in those two cities.
Well, first of all, good evening and thanks for having me. The Bloomfield location is the first one, and that opportunity just happened to arise. I had no plans, was just looking for a dental home, having worked in other people's practice for about 3 years after leaving dental school. And just to preempt, I am a periodontist by trade, which means I'm a gum specialist. But I have a dental office that houses general dentist, a hygienist, and myself, the periodontist. So you could consider us a group specialist or a group practice where you can get dentistry, all type of dentistry under one roof. And so the Bloomfield office was opened by coincidence in Bloomfield. However, the East Orange office is not orange, it's East Orange and it's Irie Dental of the Oranges. That was intentional because I know the demographics of the persons who live in East Orange. East Orange is a little West Indian hub.
Uh,
So that was the drive and the attraction to East Orange.
but what about Inglewood, Teaneck, Hackensack is highly populated by Caribbean people. So are you considering putting an office in one of those facilities?
At my age, I don't think so.
Oh, what is
So,
your age?
so, so
35?
um,
No. I,
35. Turn that backwards. You're a good. You're a good guesser. Flip that around.
okay, I got it. Okay, you don't look it though.
I'm close to the flip of that.
You don't look it though.
Thank you, sir.
Okay, tell me more about your office, your service that you provide, and who should come and see you.
Well, if I see patients from the age of 3 until you have no need to come to the dentist.
How
So, which
often should
means
how often should one get their teeth cleaned?
it is recommended that you get your teeth clean every 6 months if your gums are healthy. If your gums are not healthy, then there are different arrangements that are made depending on your need.
Wow, depending on your need. What inspired you to become a dentist?
Glad you asked. I hail from the beautiful parish of Hanover, Jamaica. And growing up, I had the luxury of living with a dental assistant. So I went to work with my stepmom on a regular basis. She used to work at the Hopewell Clinic, and they used to have rotary doctors from the US. And there was a resident dental nurse, Miss Dawn Davis, who is from Hopewell. and she gave me the opportunity to assist her. And from then I was sold. And for the past 26 years, I am happy that I chose the right profession.
Oh, wow. Yes. Where did you go to school?
Where you want me to start?
School.
Went
Dental
to
school.
Bethel College.
Where?
Went to Bethel College in Hopewell, Hanover. Then passed common entrance at about age 9.5. So I started high school before I was 10 years old.
Right.
Went to Mount Alvernia High School.
Mm-hmm.
Graduated class of 1987. Went to COMC for 2 years. Went on to UE for a year and a half. Migrated to the US. Went to Uppsala College in East Orange, New Jersey. From
Mm-hmm.
Uppsala, I went to University of Medicine and Dentistry, where I did my dental degree and also specialized in periodontics.
Do you do home visit to senior citizens?
I have done a few home visits to members of my church community.
That's all? Only your
Yeah.
church?
Well, that's what I've been asked to do. Again, there's not enough hours in the day to reach out to the senior citizen, but I guess we could do that like a fair or something, but not on a regular basis.
So, what do you think of doing a fair somewhere in Bergen County, Passaic County, in the near future, where people can just come and you diagnose them, or check their gum out?
I've done something with Tony Culture before at his music
One
reggae in
Love
the
Jamaica,
music in pardon me?
One Love Jamaica,
Yes, I have done that with Tony some years ago.
years ago. But we need to revamp and organize something that we can set up so people can come out and you can test them and
I
have
have
them.
no problem.
Okay, so Tony Culture, we got to set something up for Dr. Parkins to come out and visit the community. You understand, and give us more knowledge of how we should and take care of our teeth. Okay. Now the next thing, how often should one brush their teeth?
Every day, at least twice a day, morning and before you go to bed. The before you go to bed is most important. 'Cause
Okay.
you want to go to bed with a clean mouth.
How important is flossing?
Very important because the floss goes where your toothbrush cannot go.
You hear that? Mm? And how long you
And
say been in America? How long did you? How long you since you've been
I
here?
have I've been here since 1989,
Okay, 1989.
and I've been a dentist for 26 years.
In the same facility, right?
Pretty much, yes. In the same state.
In the same state. Okay.
Yes.
All right. There's anything else you want to talk to us about dentistry?
Well, I think you've touched on most of it in that how often we should brush our teeth twice a day and before bedtime is paramount because you want to go to bed with a clean mouth so that while you're sleeping, the bugs are not overfeeding and causing cavities or gum disease and other such dental issues. Another thing, once your child has teeth, they should visit the dentist. So you don't wait until something is wrong with their teeth to take them to the dentist. Another thing is patients who are diabetic are at risk for gum disease. And so it's very important to go to the dentist to get evaluated because the diabetes is a
Kill.
silent destroyer, and gums don't like diabetes. So patients who have gum disease or
Mm.
have diabetes are at risk for losing their teeth faster than individuals who do not.
Wow. I learned something today. Now, what type of insurance do you take at your facility?
We participate with most of the traditional insurance, Aetna PPO, Delta Dental, Guardian for the most part.
United
And
Healthcare?
United Healthcare, the
Healthcare.
community one, United Healthcare Community and Horizon, we do take in the East Orange office. So East Orange is right off of Central across the street from former East Orange General Hospital, now Carewell. We are on 15 Freeman Avenue in East Orange.
Is
And
that
the Bloomfield,
as is that as soon as you come off exit 145?
145, yes,
And
coming from the north.
yes, and you make a right and it's somewhere on the left, somewhere right there.
That is correct. Yes, sir. Like I said, across the street from Eastern General, I can't miss it. So it's CVS, Eastern General, Wendy's, and the dental office, Irie Dental Spa of the Oranges.
So what hours are you in your office where the people that are listening to you right now, I know they would visit your place, but they want to see you.
Why you just put me under pressure, sir? All right. I am in Bloomfield. I am in Bloomfield on Mondays and Thursdays
Hold
from
on,
10.
Dr.
Mm,
Paul, sorry. I apologize. I stuck forward with this assignment right away because the young man is not here. As he's on his way from down south somewhere.
So what did I
However,
do wrong?
no, hold on. I anticipated you going into more about the gum disease with the pamphlets that you sent me, and so I'm just suggesting that you both discuss that, or you elaborate more on the gum disease and the prevention and such and such.
oh, not a problem. Not a
Well,
problem.
By the way,
yes.
I am a client, I am one of her patients.
So I'm gonna be your client now. I've been hearing about her for the longest,
Really?
longest. I'm telling you. I've been hearing about her for years. I just, like a Jamaican, you
But it is
just,
something named Irish that I reached over a long time.
I'm telling you, I've been hearing about her and I just never feel like go check her. Now I spoken to her, I talked to her, I will come and see you. But you say you take more.
Okay, sir.
What about a person that don't have insurance?
Yeah, for the persons that don't have insurance, we usually come up with a treatment plan and a financial plan for such individuals. So we try to make care affordable.
A
And
one-time person that come and just want to clean in and go. It is a
clean
price
and
for that.
clean. Okay, so there are some specials that are going on. For new patients, I think I don't quote me on it, but I think it starts at $150, and that affords you a cleaning, an exam, and X-rays. So we take X-rays, do exams, see what's going on, and explain to you what is valuable and what you should get done. And if it's not broke, we usually don't fix it.
Okay, explain to me more about the gum disease and the pamphlet you sent.
Okay. So with regards to the gum disease is called periodontal disease or periodontitis. That is infection of the gums. It affects the tissue and bone that surrounds your teeth. And some of the warning signs of periodontal disease are that your gum bleed when you floss. Your gum is usually red and puffy. The gums no longer tightly hug your teeth. Persons who have bad breath are usually individuals exhibiting signs of early or late gum disease. If you notice that there's increasing space between your teeth, like you get up one morning and you just see a space between your two front teeth, whether it's the top or the bottom,
Hmm.
you should take that as a red flag to go see your dentist as soon as possible.
What
And if
about
your dentist can't deal with the issue, then it is incumbent upon them to refer you to someone like me, a periodontist, for specialty care.
what about someone that is born with a space between their teeth?
If you're born with space between your teeth and is happy with that, then that's okay. Most Jamaicans think it is cute to have space between their front teeth, and I'm okay with that. However, if it is a problem and it is causing you issues where you cannot bite, where it's messing with your self confidence, then you can seek help to correct it. i.e., the correction would be doing orthodontics to close the space, or you could do restorative work to close the space.
I see here where you said using tobacco of any kind, you are more likely to have gum disease if you smoke, chew, or dip tobacco. Now, I know someone is about 77-year old, and I'm gonna look. I'm gonna talk to him tomorrow, and I'm gonna try and bring him to you. He smoked for 40 years or more, and his teeth is brown. And can you do something to that? Can you correct that? Can you fix that? Can they come back white?
Yes, they can come back white because usually the brown is probably not only the tobacco staining, but it could be as a result of tartar or calculus buildup on the teeth. What is calculus? Calculus is bacteria plus old food that sits in your mouth for too long. So yes, we can get it back white by removing some of that. As to how treatment will be, I cannot tell you that until the patient is in my chair and is assessed.
Okay. For those of you just joining us, can you give them a number for me, Doc, where they can call
For
and
the
make an appointment?
For sure. For the Bloomfield office, it's 973-743 IRI, which is 4743. So again, Bloomfield is 973-743-4743. And for the East Orange office, it's 973-673, same IRI, 4743. 973-673-4743 for the East Orange office. So the only difference between the two number is the second exchange.
Okay. I notice you have your pamphlet that if you're taking medication, you should inform your dentist about it. Why is that important to tell you?
Very, very important because some of the medications that are given to us as people of color have untoward effect on our oral tissues. For example, there is one called amlodipine or Norvasc or most of the calcium channel blockers. They cause your gums to overgrow. It's called gingival hyperplasia. It's just one of the side effects of the medication.
Wow. Also, I see where you say pregnant use of birth control pill can change in female hormone level. They can increase the
That
risk of gingivitis and may cause your gum to swell and bleed. I really didn't know that if a woman take contraceptive, they would change their female hormone.
because what the contraceptive is doing, it is increasing the level of your progesterone estrogen. And so when you are pregnant, I think it is the progesterone that is increased. And for some reason, the bacteria that causes the gingivitis love those hormones. And so they're produced more, hence causing the gums to become soft and puffy and bleeding. So it's called pregnancy gingivitis. And I also tell patients that the mouth is the entrance to the temple. So that entrance, at the entrance, you can see a lot of things that are going on within the body itself.
Wow. So it is very important, ladies and gentlemen, if you're out there listening, if you're tuning in for the first time, you're truly Fat Forward. And of course, you can catch me personally and Linkage Radio over there in the Bronx, New York, every Thursday night between 10 and 12. And of course, you know I'm not there tonight. So Keelan is holding down the fort because I am doing this for Tony Culture. So, Doctor, is there anything else you want to tell us about dentistry, please?
Since you just mentioned the Bronx, I also work in the Bronx at 3370 Baychester Avenue at Optimum Dental. I am the periodontist there, and there's an oral surgeon, Dr. Dwight Williams, and his office structure is similar to mine. He's one of my mentor, and so you don't have to come to Jersey, sir.
No. I live right here. I live like 3 minutes from here.
Oh, okay, okay, all right,
I
all right.
just party and do business in the Bronx. That's it.
Okay, all
And
right, all right. So
where
yes,
you're
I do go to New York. I have a license to practice in the state of New York.
so you go to Cove and dumpling shop and eat.
Ah, it's right down the road. Yes, sir. Yes, sir.
Okay, I know where your office is located. But
Yep,
you're
it's
giving me the address.
between Tillotson and Givens.
Yes. So you're there. Okay. Gotta check
I'm
you
there
out.
2 Tuesdays a month.
Is it the first, second, or third Tuesday? Or first and
It's
third?
usually the third and fourth.
The third and the fourth. So the last 2 Tuesdays
Yeah.
in the month.
Yes.
Okay, so you're gonna be there next Tuesday,
Next week. Yes, I will.
and you was there yesterday, Tuesday.
Yes, I was. Mhm.
I want to catch you in the Bronx. I will wait until you're in your office in Bloomfield. Bloomfield is closer. Yes.
Yeah, you have options. Mhm.
Yes, Doc, and it was a pleasure talking to you. And of course, there is
Why you
more
sound as if,
thing.
why do you sound as if you're trying to close out? It's not time to close out yet.
What else you want me to talk about?
Yeah,
There's so much you can talk about with your mouth.
yeah, but there's a lot of more after. There's a whole lot on the pamphlet, which there were 6 pages, or at least 6 pages for the pamphlet.
Yeah, but I did go through a lot of them. Is what Tony Culture? What's wrong with you, man? I'm not you.
Well, first of all, giving and believe me, she's giving me time, valuable time, at least what, for an hour. And
Can you ask her? I've been through
well,
everything.
does anyone here have a question that you would want to answer, Dentist?
Any question for the dentist? We got people here.
Yeah,
Any
because
question
I
for the
mean,
dentist?
anything you ever thought about or wanted to know, you can ask the question.
It's for free right now.
And
These ladies are shy, doc. They are
They're
shy.
shy.
Yeah.
Well, tell them we do personal consultation, so they don't have
Yeah.
to be shy.
Come over here, Yami.
does she take all insurance?
What insurance you have?
That's the talking.
Someone is asking if you take all state insurance and stuff like.
The state insurance, well, it depends on which state you're in.
New
In
Jersey.
New Jersey, the state ones we use are Horizon and J Health and United.
I can make him use mine. Don't worry about it. It's okay.
No, we don't do that.
Now you don't know.
Yes, we do.
He's coming as me.
No, no, no. See, I know you. So you must come with your ID, and your ID must match what is on the cards.
Trust me, we got it.
Okay, Jamaicans.
Your teeth are health, help to place a gum bone and condemn. Yeah.
Hold
She
on,
said,
Dr. Parker, did you
yeah.
say where did you start dentist school in Jamaica or here in America?
No, I did college and dental school here.
Here, okay.
That means you wasn't
Mhm.
listening,
No, I wasn't. I was busy doing
but
something
you're
over
asking
here.
the question that I asked already.
Well, it's not. There's nothing wrong with reiterating it.
Okay. You want it? She tell you again?
No, she does this. No, you know what? I was on the Dr. Parker. Um, by the way, I don't want to answer too much thing, but we're in Jamaica. Where you situated and meeting
Hanover.
you? Oh, I know about.
Ah,
No, you want no, you want no, you. Man, when one of them Dr. Parker is the up or the uptown girl in
she
Jamaica.
said it. Hanover.
I am from the
Westmoreland.
beautiful parish of Hanover. Born at Noel Homes and grew up in Hopewell.
So you never go to school at Kingston?
I went to UWI for a year and a half.
No, she just went to UA, but she's a decent woman. She never party like you when you was
I
going.
went I went to Mount Alvernia, a high school in Montego Bay.
She's very down to earth. You don't say that.
Yeah, but she's country. She's not like you when you were
I
going to.
am I am country. I love it.
Yes, and she was a decent young lady going to school. Not like
I,
you, Tony. You still have a flask in your bag in a class. Okay, Doc. What else did we? What did we not touch on?
We touch on the basics that should be reiterated right now, and I think that's enough information for one to decide if they need our services. And again, don't wait until it hurts to come in because it's gonna hurt more.
Oh, why are you talking about me?
It's gonna hurt more.
I've been waiting to go in actually.
Hold on now.
Ounce of prevention is better than a pound of cure.
I got that. Okay. Someone is asking you to repeat the address. I have no pen and pencil here, so
Oh yeah, that Bloomfield is 275 Broad Street.
275.
Broad Street in Bloomfield, New Jersey, 07003. And the phone number to Bloomfield office is 973-743-4
No, take it. Slow down, Doc. Okay, you getting it? 973
743
743
4743.
4743. And repeat the address for us.
275
Broad
Broad Street.
in Bloomfield.
That is correct.
And you're there
Mondays and Thursdays
Mondays and Thursdays. What hours?
from 10 to 4.
From 10 to 4. That's the only 2 days you're there.
And I'm there some Saturdays. I think I'm there the second Saturday of the month.
What about Sunday?
No, sir, that's a church there.
After church.
No, no, no. Mm-mm.
Okay, just checking. Just checking.
So if I go to the 12 culture time, do I get a free checkup?
No, you get a discount. If someone come and say they heard you on Tony Culture Time, what is the incentive for them, please?
But it depends. If they have insurance, then we will treat them accordingly.
No, no, no,
If
no, no.
they don't,
No,
if
no,
they
no, but
don't have insurance, then there is the special, the new patient special, where
the,
I said it's $150 for your exam, X-ray, and cleaning.
that's not what he's asking, Doc. Like on
Mm.
like most of the time when we advertise on the radio, we say if you say fat forward, you hear it on that program, you get X amount discount. Not every time, but you get something. You understand? That's what he's saying. Regardless of the insurance he have, you understand? He want a checkup. Does he get a discount from the 150?
If he wants a checkup, it's already discounted,
Uh,
so I doubt it. And
No,
let me tell you something with regards to insurance. So with insurance, there's preventative services and there are basic services and major services. Usually, most insurance cover basic at 100%. And if we are giving you a discount with your insurance, we have to tell the insurance that. And so the fee structure is going to change. So insurance is very tricky. So we can't give discount on top of insurance. It's just the way it works.
okay. Now I'm gonna ask you the same question a different way.
Mm-hmm.
The person has no insurance paying cash. Can they get a discount from the 150? We're
I
Jamaicans.
I
And I would bring
exactly.
people like this.
Listen, you said it. I thought it, but you said it. So I tend to stay away from the money discussion. I do the dentistry, and I don't want my girls to fire me from that department. So to tell
You're
you that
too
you
you're
get
too
a
smart, you know. You should be a politician.
so I am not going to get myself in any trouble on this airway, sir.
Okay, I like that. That's a politics talk, you know. Did you know that?
Boy, not really.
Yes,
Just
it is.
protecting. It's just protecting myself.
That mom is the word, right? That you take the fifth on that. I don't know nothing about that department. I like that. I like that.
Nope.
Is there anyone that wanna ask any more question before the doctor go? It's I don't even know the time. It's
10:32.
10:20 32. 28 minutes to 11 o'clock. And a lovely Thursday night where the temperature on the outside is about 28 degrees. And of course, if you're in the
Ouch.
tri state
Ouch.
area, tomorrow it's going to be raining, and Saturday it's going to be 100% rain all night long, all day long, and Saturday. No, I do radio, so at least I gotta have something to tell the people. I can tell you the exchange in Jamaica,
Listen,
What is it?
$155.
Wow.
the last time I went to see Dr. Parkins, right?
Mhm.
Which was what about 2 weeks ago, doctor? And I left there feeling very clean. When you get your mouth clean,
But Dr. Cocky is
what?
Doctor, your Cocky is
Yes, sir. I'm not
okay.
listening.
Okay, you get your mouth clean from the dentist, right? And you go in at night and dirty it out back.
No, no, no.
I didn't say nothing.
No, no, go
You
so.
might go eat oxtail, soup, and
The point
cow.
I'm trying to make here
Yeah,
though is get your, what is it, twice a year cleaning, doctor? Is that how it
it
is?
Twice,
depends.
yeah, twice a year cleaning. Yes, sir.
It depends
So
on how
the
healthy you are.
No, no,
healthy
that,
smell exactly. So if you see, you pay attention, Tony is a good student.
Thank you very much, Doc. If you're healthy 2 times, but if you're not, you need at least 3 times
You can't go every 3 months, every
3 months.
4 months. So it depends on your gum status. So brush your teeth twice a day with a fluoride toothpaste. Clean between your teeth daily. Flossing, very, very important because the toothbrush don't go certain places.
and
Eat
don't,
a healthy diet that limits sugary beverage and snacks.
yo, that's my
Hmm?
weakness. And do not,
And see your dentist regularly for prevention and treatment of oral diseases.
And how often should one change their toothbrush?
Every 3 months.
and don't brush hard. I heard that. Do not brush hard.
What's
There you go. Keep
all
the
right?
toothbrush on your teeth, not your gums.
Okay. I noticed in the store you have soft, medium, and hard. Which
That is correct.
toothbrush would you recommend for our listeners?
Strongly recommend this soft to medium toothbrush.
Soft to
And
medium.
if you're using the soft, don't put extra pressure on it. That's not smart because your gum is like your skin. If you get paint on your skin, you're not going to put a brush to your skin. You're going to be gentle with it. So it is with the gums. So a lot of patients, as they age and we're brushing hard with probably the wisdom toothbrush, I hope they don't make them anymore or make them softer. You remember those wisdom toothbrush from Jamaica? I used to send home to my dad to send it to me.
Wisdom. They don't make them
Wisdom
no more.
toothbrush.
They they're hard like rock.
I won't say anything because I don't know if they still make them. However, so go with the soft toothbrush, but again, don't put the extra force, too much elbow grease while brushing, because if you brush away your gums, you're setting up yourself for a different problem called gum recession, which leads to sensitivity.
Okay. Okay, so it's recommended that you use a soft toothbrush and don't brush too hard.
That's correct. Keep the toothbrush on your teeth,
And not on.
not your gum.
Okay, for sure. I know in the morning. For those of you who are listening, I am going to make an appointment tomorrow morning first thing. I need to see the dentist. And I can't I can't disclose how long I've been to the dentist, but when I see you, I'm gonna tell you the last time I did.
No judgment, sir. We
I,
work from where we are.
I know you don't judge, but you're gonna slap me in the head and say you know better. Yeah,
Mm-mm-mm.
yeah.
Ask Tony, not even so.
What you gonna say?
I will take it from where you are. We, I am progressive. I am very progressive. We
Oh,
head forward.
okay, we're gonna make you run in the election. So you sound like a politician more than a dentist right now. You know that, right? And you've been told,
Mom's the word. Mom
yeah,
is the
but
word.
you've been told that before. Be honest.
Yeah, my father tell me that.
Thank you very much. And I don't know your dad. But by talking to you, I can tell. You understand? You always stay on the straight path. Okay. Ladies and gentlemen, we have Dr. Perkins.
Parking.
Parkins,
Parking.
Parkins, Dr. Parkins, and you gotta have something written down here, man. Dr. Parkins on the line. She is live on the Tuna Culture app right now.
What's in my cup is what I'm going to show you.
What's in your
What's in my cup?
What's in my cup? What's in
And
my cup?
by the way, Dr. Parkin, someone was asking, does the doctor have anything in her cup? And I said, she don't have a cup in here.
So you
Well,
don't.
listen, I won't have what's in my cup. I will have what's in your mouth.
Yes, yeah.
Mhm.
What's in your mouth?
See, you're gonna have this gentleman going to put me into politics now. If I'm gonna tell me, say I'm a politician.
No, what about the people gum that are very sensitive? Because I know you put that stuff on it. What you do? Put a Novocaine and kind of then the gum and then do your cleaning, or you just.
Uh-huh. All right. So see, there's a reason for the sensitivity, and that brings us to the persons who do not have healthy gums. And so usually when you have to use anesthesia, it's because you have what's called periodontal disease or gum disease. So you have deep space between your gum and your teeth, which form gum pockets. What are gum pockets? When you start to lose bone because you did not go to the dentist as often as you should, you did not brush your teeth as often and as effective as you should, and you did not floss as effective as you should, then it leads to bone loss. And when the bone is lost and the gum didn't go with it, you have gum pockets form around your teeth. So what happens when you eat? When you eat, especially soft food, it just slide into those pockets. It slide into the pocket, it sit there for too long, and basically start to break down or degrade the gum. And so you will have gum pocket with food in there. You press on it, you start to get pus. It leads to bad breath. Then you come in and see me, and I tell you that you need a deep cleaning. And then we'll get you back and numb you up and get beneath the gum with special instruments and machine to clean it out.
Wow. So if you come in for cleaning and your gum is sensitive, that means there's something wrong.
That's correct.
And you have to numb the, you don't have to use Novocaine. You have a, what you call it, a cream thing that you rub over.
Well, the cream thing is a topical, so that we use that before we use the needle. So
So,
what that does, it numbs the gum a little bit so that when we do the injection, it feels better. Sometimes you don't even feel it.
okay. And you do a nice cleaning and that's it, right?
More effective, right? Because once you're comfortable, then we could do a better job getting between the gum and the teeth to clean out what's attached to the tooth and what's sitting within the pocket.
Okay. I know definitely I'm coming to see you. I can assure you that. I'm glad I had the pleasure of talking to you tonight. Tony Culture just grabbed me and hey, you got to come and do this. So I have
The
to,
pleasure is mine.
yes, have more knowledge of what's going on in the teeth. And
Would you, would
eh,
you, would you kindly excuse me? Ask the doctor to make an appointment for you tomorrow and we'll just make it happen. Instead of you just say it and don't do it.
tomorrow, she's not there tomorrow. Tomorrow's
But
Friday.
she can call her
No,
office
I
and
know, I know. I want she take care of me. If
On Fridays, I'm in the East Orange office.
you want to go to East
hold
Orange,
on, Dr. Parkins. Isn't I
Uh-huh.
thought the East Orange office was more on the, what's, let's say, therapeutic side of things?
But they're both therapy. Both offices render the same services.
Can you make magic happen for tomorrow for us? I'll come to the East Orange office tomorrow, but in the future, I want to come to the Bergen Field, Bergen
No, it's not burgundy. Orange.
Bloomfield.
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 Can you make magic happen tomorrow, please and thanks?
I would send me Tony, send me his number and I'll reach out to him personally,
Send it.
because we most appointments are there by appointment, so you have to schedule.
Yeah, but you can bug somebody like the airline. You know,
Yeah,
I
man. Yeah, so
I got
send
my
me send
I got my friend at the airline, and I said, listen, I gotta fly, and they said, okay, let me bug somebody.
my Jamaican people, man.
For real.
Hmm.
Imagine that. Him have ask you that in a public, everybody say yeah.
No, but
You have preference to Jamaican.
that,
No.
preference for
No,
anybody. If you
I try to treat people equal. So
you hear that, so send her my number tonight, and she can send me a text tonight, and I'll be there tomorrow.
I'm gonna give you her number as I'm gonna give her your number.
No, just text her. She's gonna tell me if I can come tomorrow, man. We're doing live. Yeah, we're doing live. So do it now.
All right, you go. Yeah.
Thank you.
Next time she come in house for the interview.
Oh,
Doc, we like in-house interview, and this place would be more crowded, Doc.
uh,
But we,
I'll have a discussion with Mr. Harris and see how we can proceed with that.
Doc, you're going too
no, no,
far.
don't. You can't say that. No, 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 no,
You're going too
no,
far.
you can't, no.
Baby,
Are you not Mr. Harris?
everybody don't know that.
Okay, so we know today. Yeah.
Oh, did I just out the
Yeah.
producer? Don't show your face and they won't know who Mr. Harris is.
Say no more, doctor.
He's acting like he's on the most wanted list, Doc. And he's the innocent person around here.
I am going to protect him.
Okay, again, it's 15 minutes to the hour of 11 o'clock. Once again, I got to say thank you very much for tuning in. Thank you very much for making us your choice on a lovely Thursday night where we're hanging out with the dentist. And of course, if you have any question to ask, the number to call right here. You got a line, Tony?
No.
There is no line to call here,
line tonight.
but you can
I-
text the Tony Culture Time
I think-
app, and we will answer your question right here before the doctor leave us.
I
Yes,
want
Tony.
to express my gratitude, Dr. Parkins, for making yourself available tonight. And even though it wasn't smooth as I anticipated, hopefully you will come again sometime in the near future, won't you?
I will be happy to do that, sir.
Thank you. And I happen to know that you're very far away. To come here 10 o'clock at night and go back to where you are.
Yeah, but you can send a car service for her, Tony.
Really.
They should be more than happy to come if she don't have to drive.
No,
You
but
said
this medium is very effective.
Talk to you very much. You do a lot of this.
Yeah, so this is very effective.
In any event, Doctor, we'll do this again. And at your own liberty, you can close up with you.
We're Jamaican. We want to see you in person. You know how we are.
Okay, sir. Noted.
You'll come to One Love Jamaica if we have it.
No, but
That's correct.
I don't only want to see her at one level. We want to see her right here in the studio. Huh? Hello?
To be determined.
To be the
Mhm. And I don't want you to call me a politician anymore for the rest of the night, sir.
I refrain from that, Doc. I will continue, and when I see you in person, I will say it because you're just a dentist by trade, but a politician in the head.
Okay, sir.
And you talk like one. You
I
understand?
don't I don't I don't know how to take that. I guess it's my exposure. It,
I like what you're doing. It's okay. Many people, the way you present yourself, wouldn't even pick up on it. But I realize you don't put yourself in a corner. You just stay in the right part. You cornering yourself where you're gonna say, yeah, she said that. No, you know when to say no. You know when not to answer. You know when to ignore me.
Usually, when I
Mhm.
when I try to inspire somebody to become a politician,
Mm,
it's because of their honesty
mhm.
and their straightforwardness and all of those characteristics. Why I would usually say you should be a politician because the person deals with me
I,
very honestly.
I, I,
But I know
I,
where you're coming from. You're saying,
she just become a politician by the way she answered me. So
well,
she not putting her foot in her mouth.
I'd rather have more dentists than more politicians.
Yes, yes, but she should be a politician, or maybe she's a legal advisor to some politician.
Sir, I am a dentist.
That don't mean you can be somebody legal advisor.
No, only thing I instruct on is teeth, sir.
That is what you're telling us because you're on the internet now, but we don't know your personal thing when you leave
By
here.
the way, Dr. Parkins, when you go to Jamaica, sorry, when you go to Jamaica, do you usually avail yourself to patients or you just go for visiting?
Oh boy. You see, why you had to go there? I was trying to refrain from that. I do have a license to practice in Jamaica, so I do work in Jamaica.
You don't.
I
Because
do.
Oh, so how is it? Is it hard to get a license here?
No, it's not. No, it's not. You just have your credentials, you do the exam, and then you will be certified as a dentist.
So why
And
don't
now Jamaica has two dental schools. There is one at UWI and one over at UTech.
you do that? And both of them are close to each other.
why should those?
Um, I do work in Jamaica.
Oh, you do?
Yes. Our office is Emirates Implant Center. It's at 4 Hillcrest Avenue off of Hope Road in Kingston.
And the only time you're there when you're on vacation, right?
No, I try to go down at least once a month.
Wow. And you spend a week, 2 days, 3 days,
5 days.
5 days. That is so good. Oh my God. I didn't know that. I got to get that information from you because I got a lot of friends down there in Jamaica and them want foreign dentists.
Oh Lord.
You know,
Yeah,
Jamaica.
listen.
You
Yeah,
know,
well, in that office, we are all board certified in our specialty.
yeah.
So there, there is Dr. Beecher, who is the endodontist. She does root canal. Dr. Williams, oral surgeon. Of course, we know what the oral surgeon does: take out teeth, implants, etc., etc., maxillofacial issues. We have Dr. Ashley Lofters. She just joined us recently. She's also an oral surgeon trained under Dr. Williams. And you have myself, the periodontist, board certified periodontist.
Okay, for the people that are listening on the internet now, because we are worldwide, can you give them a number in Jamaica just in case they're interested in calling that office? Please and thanks.
Okay, I give me a minute. I have to. That one I don't know by heart, but I know the address. It's at 4 Hillcrest Avenue in Kingston, and it's off of Hope Road. Let
And
me try and find the number.
okay, we got
He said, he said, well, the doctor
we
put the
got
number.
8 minutes to go, so
Yes,
you can I can wait.
since you're making such a
Okay.
topic of that aspect of it, maybe we should sponsor somebody in Jamaica's dental visit.
Haha. So the
Okay.
number the number is 876-391-2923.
Okay, then that's for the people that are listening on the internet in Jamaica. Please give it to them again. Thanks.
876-391-2923. 123, and that's Emirates Facial and Dental Implant Center, 4 Hillcrest Avenue in Kingston.
Off Oak Road, right?
Off of Hope Road, yes. A little up from Andrews Memorial.
I used to go to Andrews and eat lunch. I used to work at Ministry of Works. And I used to
Oh,
work
okay.
from right where the police station is and walk to Andrews Memorial. That time I was trying to eat good. Cause the Andrews don't sell meat.
Yes,
That's
Adventist,
seven
yes.
days. It's an Adventist place. So
Yes,
that
yes.
that just went
That
down the door.
that is correct.
I did that for years. Ladies and gentlemen, want to thank you very much again for tuning in. Want to thank you very much for making us your choice on a lovely Thursday night. Thank you for taking time out of your busy schedule. Um, it's the doctor, it's the dentist. Yeah, me.
Doctor, I appreciate your time and pretty much thanks very much. Is what I like to say.
Appreciate you too, sir.
And Doc, it was a pleasure talking to you. And you'll be seeing my face in your place.
All right.
And
Respect.
someone is crying that they need a Tony Culture Time discount.
Yeah.
Okay.
And I agree with them. I agree with them.
Okay, Tony Culture Time discount
Discount.
noted.
No, all right. Make
Well,
note right so everybody come from say they heard it on the Tony Culture Time. Get a small discount. Don't care. Maybe two Broad Street.
Adam Gainst them was here.
Yeah, it's incentive and they bring the family down.
oh,
We want every little thing. So,
noted, sir. Noted. 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 You still want to get me in a trouble this time of night?
man, it's 6 minutes to go down to 11 o'clock, and
I'm telling you, you can let her go now.
I can let her go.
Yeah, you can let her go because
Okay,
I think she needs to get her rest.
it's a pleasure talking to you, Doctor, and I'll be seeing you. And thanks for the information that you parted with us today. And I am coming to see you. I need
I
some false teeth. I need my teeth. I need some teeth. I
What do you
don't
mean by well? Listen, we'll have that discussion when we see you, sir.
No, but I want everybody to hear because it's not us two alone listening. So my
Okay.
friends.
Listen, it's easy. All to get there in Bloomfield, you just stay with what I street the name. You come from.
Oh, you're talking to me or are you talking to the
Well, I'm
audience?
talking to everybody. You
Okay.
and everybody.
Okay.
Bloomfield Avenue. Is it? No, it's not Bloomfield Avenue. It's what's the name of the street again? I know the street.
Where you? It depends on where you're coming from. Broad Street.
Broad
No.
Street. That's it. Broad Street. It's easy.
You been there before?
All the time. That's where.
How much time?
That's where I go.
Too many. Too many to count.
Yeah, that's what
Doc, I wanted to talk to him because I know it's only 3 times him come.
No, man. No. I gotta defend him.
Another politician talk. Yes. She had defend her comrade.
Tony's a resident patient. I've seen him at least twice this year.
For
And
real?
and, and this
And
is
for
only
not?
this is only the third month. Yes, this is only the third month.
Forward. Forward.
Yeah.
Do you realize that is offended by you calling her politician?
I know you.
She's offended by you.
Oh, hold on, Doc. Let's get it straight. Are you offended?
Yes.
No, tell me.
Offended by what?
I'm me calling you a politician.
Oh no.
I know that. This the guy trying to let me not sleep tonight. Come on.
Listen, it's too late. It's too late to be offended.
But listen to me. I asked her if it's the first time she heard that. She tell me no.
No, my father has told me that.
Thank you. And that is always right.
That is true.
That is always right.
I guess it's in my DNA, but I have never tried to activate it, and I'm not going to.
I still have you as a politician. You give legal advice to some politician.
Aye. Okay, sir.
Thank you very much, Doctor.
When I see you in person, we will have that conversation.
Off the air. It was a pleasure talking to you. I learned a lot where dentistry is concerned, and I know people that are listening right now learn something. So again, thank you very much. Thank you, thank you, thank you. It was a pleasure.
You are most welcome. And remember to send me a number.
I'm sending it tonight.
Okay, sir. Be
And
well.
if you can squeeze me in tomorrow, I'll be there.
Okay. Well, send it to
Because
me and let me
I
see.
have a date tomorrow night, so I want a clean mouth.
All right, sir. All right. We see what we can work out.
Thank you
I,
very much, Doc.
I understand the dynamics of my people. Mhm.
All right, so
Mm.
and of course we get off to here now. And once again, thank you. I
All right.
want to
Right.
say
Have a good night.
bye bye.